Hello and welcome parents. Thank you so much for participating in today's talk of toddler issues and its homeopathic treatment. This platform is called Parenting Twigs Mini Talks. We have it every week. We call experts on this platform. So generally it's on Saturdays, but this time we have opted for Friday and Saturday both the days. And the talk will be around for 45 minutes and which will be followed by the Q&A questions. And just to brief you about what Parenting Twigs is about, Parenting Twigs is a parenting forum from age group 1-day child to a 20-year-old child. Parents can ask questions, ask help, and however possible way, I try and answer that and address that if I can help out, or if not, then I will take some expert's help and I will get you connected to that person. So this Parenting Twigs is 2 years old. It started in March 2018. And since then, it has been exploring and helping. We have been helping lots of parents on this platform by conducting all small, short talks, discussions, and lots of other things happening. From this year, September onwards, I started an online stuff of having a Zoom call, calling an expert on the platform so that you can have a live interaction instead of having a WhatsApp interaction. So this was a more impactful way of connecting with an expert, asking questions, knowing more about what is happening in your own world, where your challenges are, and the expert will be able to tell you more about it. So about today's talk is about toddler issues and its homeopathic treatment. So she's not just going to talk about homeopathy. We all know about homeopathy, but she has much more knowledge beyond that as well. She's Dr. Yatri Thacker. Welcome, Yatri Thacker, to our platform.
Thank you so much for having me over.
And she's also a part of multiple platforms. She has been taking these. Her talks are amazing. If you have followed her Instagram, you will see lots of videos on it. If you have followed her Facebook page, there are so many videos that she has are connected to and talked about all small issues, whether it's about the toddler or whether it's about the teen problem, whether it's a PCOS. I think that was one of the talk which you had done.
Yes.
Or stress management, or any talk which is a challenge in your life, and she has compiled it with a homeopathic treatment. So she's an amazing doctor. I am one of her patients. My son is one of her patients. We take her medicines regularly, and I'm very happy with the holistic way she does the treatment. It's not just about okay, you have got sinus, go take and you will be treated. She talks. She understands what is happening in your world, and that's where the specialty and the USP of Dr. Yatri Thacker is. So over to you, Dr. Yatri Thacker. This platform is all yours, and yes, thank you so much. And if any question, please put it in the chat box. Yeah.
Thanks, Sarita, for these overwhelming words. I truly appreciate. But of course, thanks a lot to you for creating this platform and making parenting an importance in our lives. Okay, so parents out there, just switch on your videos. I would love to see your faces. We all are home. I know we all are busy, and I know we all are working with kids around, but keep on mute, but switch on the video. That's my small request to you all. So it will really help. Also, this session is going to be an interactive session. So you can ask any kind of questions and I'll be more than happy to answer. So you can, and I'll try and help you and guide you further. Okay, so parents, can you please switch on your videos?
Yatri, there are many times people are not able to put on their videos.
Okay.
They will be able to answer
whoever
your questions.
Can.
Yeah.
Okay, whoever can.
Whoever can, they can.
Great. So today's topic is toddler issues and its homeopathic treatment. But before that, have you ever pondered on these important questions of your life? Once you be a parent, it is really not that natural instinct for few to bond immediately with your child. And for few, it becomes very natural to bond with them. Yet, as a parent, we have to ask ourselves a lot of questions so that once we understand what space we are coming from, it's very easy to take care of your child's physical and mental issues. Okay, especially we'll try and focus about toddlers today and its treatment. So the important questions that I want you to ponder on are, what are you operating from? What was your childhood like? Was it happy? Was it contented? Was it sad? Was it depressing? Was it with ups and downs? What are the things you wanted to achieve as a child? And are you looking for the things that you are lacking in yourself, in your child? Are you one of those parents who is trying to push beyond your limits because you have not achieved somewhere as a child? Or are you one of those parents who is operating as your mother or as your father? Ask these questions to yourself. Are you connected to yourself? And if you are internally connected to yourself, parenting is just a cakewalk. Last question I want you to ponder on is, how do you want your child to be? You want your child to be happy. You want your child to be satisfactory. You want your child to be joyful. You want your child to be whining. How do you want your child to be? Okay. So once you try and answer, the focus of my practice has been towards one that is of consciousness and choosing conscious positive parenting. Now, what is that? Is you have a positive frame of mind, and you as a parent know that the initial years of your child who is a toddler are the most important years, because that is going to leave a mark on his physical, mental, and emotional well-being. So adopt a positive mind frame for that. Okay. So understanding the space that you have to operate from, even if your child is unborn, if you're pregnant, if your child is toddler, your child is growing up, your child is an infant, your child is a teen, or your child is any age, but you try and operate as a conscious parent. So today's topic is about toddlership, and what is this growing as a toddler? What is that age group that we are looking for? Okay, so actually it is between 1 to 4 years of age. People sometimes feel 1 to 7, but the actual age of a toddler, which we call them toddler, is 1 to 4 years of age. Beyond the age of 4 or 5, then they start growing up as children. And of course, after 13, they become teens. Okay. Now, what are these common toddler issues that these children grow through? You know, a child when enters toddlership, they go through a lot of cognitive behavioral issues, and they develop both physically through cognitive ways, through skillful ways. And we as parents should try and approach holistically towards your child. So there are these neurons in your brain, in the child's brain, which connects with the hearing, which connects with the sight, which connects with the understanding of the child's brain. And if you have a balanced parenting style, your children become more better learners. They become high on emotional, they understand feelings of each other, and they become a better, sensible human being who can deal with their stress, who can deal with their issues further. So let's try and focus towards it, that, and with this understanding that when your child is a toddler, understand this, that your child is going through the most important phase of his life, most important phase of their life, and the child is also being at that time having more of these development neuron synapses, which is so important for them to develop a balanced adulthood. Okay. Now, there are certain common toddler health issues which are seen, which are, I will name them and then I'll tell you how one can go about it. Allergies, common cold, bedwetting, appetite issues, both children who eat too much and children who eat less, both. Okay, so obesity and anorexia, both are this who go through. Am I audible? Just give me a thumbs up. Yeah, great. So appetite issues both for obesity and anorexia. Then worms. It's another problem I've seen
deworming is so important during toddlership, teething. UTI is urinary tract infection, and some common skin complaints like warts and molluscum. Now, I have seen in my practice, parents usually, they can't differentiate between allergies of the child and common cold. And that is one of the things that affects the children most. Now, let me tell you, parents, this is a very interesting thing, that there are about 200 to 250 viruses and bacteria in the air. And every time one of that bacteria or virus affects the child, the antibodies are produced in the body, which fights and throws away that bacteria and virus. Next time the child falls sick, that same bacteria virus doesn't affect. So as the child is growing, the antibodies are developed, the immunity is also building. So we usually see these younger children who fall sick more often. The same kind of common cold and cough you don't see in adults, do we? We usually don't. Yes? So that's the reason why common cold is so common in children. But how do we differentiate between allergies and common cold? Now, the only way you can differentiate is if your child has cold cough with fever, okay? Understand it is due to a bacterial viral infection. If there is no fever, or if the fever is mild, or if you find your child dull, if there is no fever, I'll repeat, if your child is dull and still has cold cough, it could be due to allergies and not due to common cold. Okay. The second way of noticing is the expectoration which comes out, the phlegm that comes out. If it turns from watery to yellow or green, understand it could be a bacterial infection. Okay. The third way of differentiating it is allergies go on for a longer time. So say if your child wakes up in the morning and sneezes continuously, okay, but that goes on for 15-20 days. That is allergies. So allergies are chronic issues. That means goes on for a longer time. And common cold or the fever, the bacterial infection, viral infection are acute problem. So the child will have fever for 3 to 4 days, maximum 5 days, and then becomes normal. So these are the three main ways of differentiating before a parent goes into panic. Oh, my child is falling sick all the time. Okay. So now one, as a parent, if you understand to differentiate, let me educate you on the things that you can avoid completely so that we avoid those allergies. Now that I'm seeing very common in my practice, children, especially after the age of 5 to 7 to 10, they come to me and my patients say, doc, do something about my son. He's having asthma. He's breathless. He's continuously coughing, running nose. He has this green discharges and, he's dull. What do I do? Those are symptoms of allergies. Now, to avoid the allergies, I say start from infancy when the baby is born. Avoid usage of talcum powder completely. For the human body, there is no difference between using a talcum powder or dust around. It's the same concept. So avoid talcum powder. Instead, use moisturizing cream. Now, when you buy the moisturizing cream, see to it that it's written it's hypoallergic. Check the ingredients, guys. The ingredients should be paraben free, should be without any kind of perfume or artificial smell or artificial chemicals. So whatever products you are choosing for your child, see to it they are hypoallergenic. Okay, that's the first way to avoid allergies. The second way is to throw away any kind of soft toys they have. I know parents, you love it. Kids find it very sweet. Some of them get emotionally attached. But I usually advise parents to get toys which does not have fur because that attracts a lot of dust. How often do we wash our soft toys? Maybe once in 6 months. Yeah. And when the child is cuddling that soft toy and sleeping, imagine the amount of allergy and the dust you're giving the child. Okay. So throw away soft toys. Instead, buy stuff which doesn't have fur and soft things on it for the children. Keep happy faces around. If you want to bring that happiness to your child, keep happy faces pictures in your in the child's room. Okay. The third way to avoid allergies is avoid keeping any kind of pets in the house. Dogs, I've seen cats in few people's house. Children are allergic to it. Okay. Avoid any kind of carpets, any kind of tapestry, which can attract dust. And the best way, if you think your child has allergies or not, you don't know, right? But the best way to avoid dust is vacuuming, especially the bed that the child is sleeping, because that's the maximum time the child is going to sleep. So vacuum the bed the child is sleeping, that's about 8-10 hours. In toddlers, sometimes 11-12 hours. Clean the curtains, wash them nicely, vacuum it. That itself will help you. Okay, so this is the main thing that you can take as prevention. I always say to my patients, I'll be at the happiest doctor when your child is okay, because and take steps towards prevention rather than cure. Okay, so take steps towards it rather than finding treatment. Next, bedwetting. Now, bedwetting could be genetic. For boys, you have to check the stream of the way the urine stream is going. If it's ballooning happening at the phallus, then you need to speak to your doctor or a surgeon, somebody who can help you. So bedwetting could be physiological. That means some problem in the organ itself, or it could be due to some kind of stress or fear or genetic. Now, toddlers, as I said, it's 4. I usually tell my parents who come to me is if the bedwetting goes to 5, it is still okay. But after 6 years of age, if the bedwetting continues, then it needs to be treated. Okay. Homeopathy really helps. I'll come to the homeopathy part, but bedwetting is something quite common. Next is appetite issues. Now, every parent is bothered about appetite issues. My child is not eating what we are providing. They are not eating vegetables. They are not eating fruits. We have to run behind the child. My child keeps on watching TV only, then eats. Parents, appetite issues, habits that you need to change and bring in your child happens right from 1 year of age. So it's the kind of habit that you continuously put in your child. That's what they're going to develop. So a 1-year-old baby doesn't know what TV and mobile is till you have exposed it to them, or till they don't see as we as parents doing it. So see to it, at least your table manners are the ones which the whole family is following. So see to it that, you sit on the dining table without any TV, anything, make the child sit besides you. And if your child is a fussy eater, there are certain tricks and tips that I would want to give. In fact, I've written few articles in Mother and Baby magazine. The next issue is going to come soon about appetite issues. And my tip for the fussy eaters is, apart from camouflaging your greens, camouflaging is hiding in your parathas, like you can put stuffings of parathas, make it like a green paratha with palak. Apart from camouflaging your greens, you try and include your toddler in making or cutting, or in the kitchen in doing something. For example, if you cut slices of tomato, first let them touch and feel the tomato. In that way, the vocabulary also increases. They see things around, so they get a lot of interest in the food and the fruit. So let them touch that tomato, let them see it's red in color, and then you cut the slices and allow them to place it on the sandwich and eat it. That's one way of doing it. So by bringing a lot of interest, by taking their help slightly in kitchen. The other way is, even if you go marketing to buy fruits and vegetables, take them along. That way they will learn so many things. Imagine they will learn the names of the fruits and vegetables. It's so interesting. They learn the colors. They like to touch and feel. That means their motor skills are enhanced. Their cognitive skills are enhanced. And then they want to try. So that's my another tip for fussy eaters. What you do is make them try multiple things rather than just that one thing. I've had parents who say, मेरा बेटा tomato soup नहीं पीता है. But every day, if you give tomato soup, is your child going to like? I'm going to ask you as a parent, are you going to like having every day the same food? Having the same khichdi every day with vegetables? No. Make it more interesting. So think and be a smart parent while giving food to your child. So smart parent in the sense, if you say khichdi, it has dal and rice and vegetables. You can make so many innovations out there. Okay? So try new things, make it very nice, looking attractive, give them a lot of choices. And finally, for fussy eaters, parents, I would say, just be consistent and persistent. If you are consistent to give the same thing every 2-3 days, your child will surely eat. Okay, so try these tips and tricks for appetite issues. Okay, next common thing which I see in toddlers is anger tantrums. Okay, now anger tantrums, or I would say, some children, they just, apart from tantrums, they are the ones who would say no for everything. They would be stubborn, they will just not listen, and slowly go towards behavioral issues in children like restlessness, ADHD, low self-esteem, this anger tantrums. What does a parent do for that? I have a whole, in fact, at my clinic, there are parents who come to me, just take 1-2 sessions for anger tantrums. So I actually train parents and they do better while parenting. But my 2-3 important tips for this are: 1, if your child is shouting, observe your own reaction, okay, and be firm and calm rather than shouting back at them, because that's what they're learning. They are learning that when I throw tantrums, my mother shouts, and that's what I'm learning. And I might be quiet once, but the second time they will shout even louder. So see inside what your emotions are. What are your communicative style? How are you dealing with your child? I advise parents to go out there to your toddler, be firm, but have eye contact, be at their level, communicate with them. If they still don't listen, just leave them alone for some time. Once they cool down, then you go back to them and speak to them about what they actually felt. Try and understand the cause, what your child actually felt, and bring that trust with your child. That itself will help to reduce the anger tantrums in children. Trust me, guys. Okay, so try these few tips. Next is worming. Now, deworming is a problem, again common, but parents fail to actually deworm their children once in a year. Your pediatrician will tell you about it. You can speak to them. But I have seen in my practice that there are parents who do deworm their children, yet the child keeps on having worms issues. Now, what are the symptoms of worms? If the child has worms, what happens is the child does not gain weight in spite of eating well. That's one of the symptoms. The next symptom is the child has a lot of craving for eating something sweet all the time. Okay, so the sweet craving is there. Next symptom could be some kind of skin rash, or they have itching, in their nose, in the nostrils, or around the anus. Also, the children are extremely cranky without no rhyme or reason. Maybe they could have worms issues. So again, homeopathy is very good medicines for deworming your children, in spite of you deworm your child with the allopathy syrup. Okay. Next is teething. Now, most of them think that teething is an issue which goes on till 2 years of age. Sometimes it goes on even to the 4 years of age also. Okay. The troubling of the teething is, everybody knows that homeopathy works so well. But if your child is too cranky, has fever all the time when he's having a new tooth out there, then you can try and see what you can do your best. But he might be having difficult teething for sure. Okay. The next common health issue is UTI. Now, UTI is urinary tract infection. This is also, I've seen commonly, where the child, actually, it begins with consuming less water or less liquids. Ideally, a toddler should have about 1.5 liter of water, which not only throws away toxins from their body, but also helps to bring that balance. So if your child has any sudden fever without any cold cough, you could think of UTI. Now, I've seen commonly in children who are still on diaper till the age of 4 or 5. They have not been potty trained, and they are the ones who can get UTI quite often. In little girls or boys, if the panty is not very well clean, in case if they are allergic, they have a very sensitive skin, so they could have UTI. The symptoms could be burning while urination. They could have fever with chills, basically, stomach pain is also, I've seen, quite common in children having UTI without any reason. You've tested the child completely, but my diagnosis says sometimes it's just UTI. We do a urine routine, check if it's positive, and then treat the child. Now, if your child is on diaper, I advise parents, usually they should be potty trained, surely by the age of 1.5. Remove the habit of wearing diapers after the age of 1.5 year old. They should be able to feel that sense of urinating. Okay. If not, you must check with your doctor. Okay. And the next things are warts and molluscum. Now, that is what is again a common skin complaint. What are warts? Warts are these double layered, they are brown color, double skin which comes. It is painless, but it comes, I've seen on the cheeks, on the face, on the body, everywhere in the body. So that is again a common thing. The cause is unknown, sometimes genetic, but it is a problem and it is seen quite common in toddlers. And next is molluscum. Molluscum are these white boils all over the face, especially in uncovered parts. It is actually a contagious skin problem, which is mostly seen when children go to the preschools. It's transferred from one child to the other. It is also seen when children use common swimming pools or bathing areas. That's a skin problem which is commonly seen. Okay. So these were the common health issues that we see, and I tried to tell you and give my tips how one can diagnose as a parent, and at least understand what is the problem and take an expert advice. Okay, next. Now, all these problems that I have pointed down, homeopathy works extremely well with this. Okay. But parents have a lot of notions around homeopathy. What is it? How is it? And therefore, I have penned down the commonly asked questions to me, which is what I would want to discuss. So first, what is homeopathy? Homeopathy is a individualized science. Here it helps to boost the immunity of the child while understanding the core issues. And when I say individualized science, it means, what does it mean? Say if I get two children having allergic rhinitis or allergies of cold cough. Now both these children would suffer from the same disease, right? They might have same symptoms, but both these children are different from each other, right? So accordingly, our medicines, homeopathy medicines also differ, because we do not just treat just one part, but the person as a whole. So if the child is having allergic rhinitis, I will not give homeopathy just to treat the allergies. Yes, that will be taken care of, but I would give medicines which will take care of the child into complete holistically, their personality and other things, and then prescribe them medicines. And therefore, we homeopaths, at least the first initial case history is a little long, which is about half an hour, 40 minutes, because we want to understand the child better. So this is what homeopathy is about. Okay. Now, how is the action? The action is actually, there is a lot of myth around homeopathy. People feel it is slow acting. It takes a lot of time. It creates a lot of aggravation. What if you've added steroids? These are the common questions that come to me. And my answer to you is, it's a total myth. Actually, homeopathy really works fast. Homeopathy's actions depends on how long the disease the patient is suffering from. For example, if your child is having fever since 2 days, my medicine will work with you that fast. If the child is having cold cough since 4 months, it will take some time for its action to show up. So it depends on how long the patient is suffering from, and so be its action. Now, it doesn't have side effects, and children love it because it is sweet to eat. I've seen children coming to my clinic and saying, "Doctor, can I have those plain pills also?" And they come and take it. They love it so much. So yes, they are sweet to have. They don't have side effects, and it actually works in the core. Now, the way I work with my patients is not only understanding where the disease is. I will try and help you as a parent. So sometimes there is connection between pregnancy history of the mother, the kind of environment that is going through. Sometimes it is the environment. Sometimes the cause is something else. Now, when I say that, what I mean is, especially when it is seen cases like bedwetting, okay? It could be like a physiological problem. Sometimes it's out of fear. Parents don't even know. So we take into consideration all of that through role play, through fun way, take the case history and give medicines to see a transformation. Okay. So these were about homeopathy. Now there are certain common homeopathy medication which I would want to mention, and you can maybe give your children. One is 5-4-6X, which is a multivit in homeopathy, and you can easily give your child. It's like a big globule, so 1 pill 3 times a day, and it will not have side effects. You can give for 2 to 3 months. If your children are having appetite issues, maybe there is this syrup called alpha pediatric, depending on your child's weight, we prescribe, but it's about 1 tablespoon before breakfast, which helps to increase the appetite. Now, in spite of doing all of this, if it's still not better, you can get in touch with an experienced homeopath. Okay. Now, though today's topic is all about homeopathy and toddlers, I also wanted to bring in positive parenting or conscious parenting as I began my session with. So these are few tips for positive parenting. First one is be aware of triggers and emotions. This is especially to deal with anger tantrums or stubbornness or any kind of behavioral issues. Okay. Now, so check what the trigger was for which your child is throwing tantrums. Okay. Check their emotional status. So go to them and say, what is it that you feel? Make them connected for themselves. Okay. So be aware of triggers and emotions. Second and most important, I would say, is be a role model. You know, when parents come and complain that my child is on screen all the time, or my child is eating too much and is obese, I would always ask them, are you doing the same? Are you being a good role model, or is there something else? Okay. So it's one of the best way to develop good habits in children by setting a good example. Third is channelize your child. So children have a lot of energy. They have this capacity to keep on learning. In fact, till the age of 5, till they are toddlers, they can learn multiple things and make the most of it. So channelize your child through sports, through music, through dance, through reading books, through art. Try and bring all of this little together. Okay. Physical activities, I can't tell you the importance of sports and physical activities in a child's life. That brings discipline, that helps to tone the body, that teaches so many things to children. So expose them to different kind of sports. Okay. Next tip is encourage a family bonding. Spend that quality time with your child, play board games, involve the grandparents, involve everybody while you're having family bonding time. Next is encourage a healthy meal. It is again an important thing. You yourself eat healthy, nutritious, fresh food and give the same to your child. And finally, last 2 is accept your child where he or she is, because they are unique and they are beautiful. So love them unconditionally and stay involved with them to bring this change. So what were the keys to bring this change or transformation? My main 3 keys that I would want you to take away with you. And even if you try and apply this 50% in your life, you will change things. Trust me, I've seen thousands and multiples of change through patients. Okay. So my 3 keys to you is, first foremost, transforming ourselves first and acknowledging what are we operating from. Second, empowering children through channelizing them and being a good role model. Third, understand the importance of their health. Don't neglect it, even when they are tiny. You know, sometimes we as parents got hyper, but till we don't understand the importance of their health, how you can deal with it, go to the best expert, try and take the best things for them, and you will see a change. Okay. So these were my tips. And so before I end and say this powerful statement, I'll take few chats. Anybody has any questions? We can ask. Sarita, can you hear me? Okay, great. There's a Sarita?
Just a minute, Yatri.
Should I take the questions before just ending this?
Yes, Yatri, you can take the questions.
Yeah. Parents, you can still ask me more questions after this.
On the other thing, so.
Okay, okay. I'm so sorry.
No problem.
Okay, so first question is your from. Sorry, the name is not there.
So there is a hero which she has put across that she wants to put some light on eating habits. Have you? So that's the only one question which I can see right now.
Okay.
There are questions coming up. You can take up the questions right now.
Okay, Hiral, I think I mentioned quite a bit about fussy eaters. But if your child is a slow eater, there's a difference between fussy eater and slow eater. Okay, so fussy eaters are the ones, no matter, I mean, they would be very choosy in eating. Okay, and we as parents want to give them a lot of fruits and vegetables to bring that fiber and nutrients. So those are the fussy eaters. But the slow eaters are the ones who take a long time in eating. Now, these children develop an habit of eating slowly if you allow them to make a habit. Okay, when I say make a habit, habit formation starts after infancy and during toddlership. So this is the main time, guys, you have the power to change the habits in your children. Okay, so when I say change the habit, habit is something, it's a repeated behavior which happens again and again till the child learns it. Now, if your child is eating slowly, you see the first time, you see the second time, the third or the fourth time itself, you should try and bring a change. So what would you do? Say if your child is eating for 45 minutes to 1 hour, keep a time of 15-20 minutes by when the child should finish their lunch or dinner or their meal. After 20 minutes, take away the meal from them. Nothing will go wrong. If they are hungry, they will surely come back to you. So what will exactly happen is maybe once, twice, they will avoid eating. But after the fourth, fifth turn, they will come and tell you, Mama, I'm hungry. Okay, you just have to have patience to do it as a parent. Okay, so keep a fixed time, and before you keep a fixed time, announce that to your slow eater that today we are going to have a fun eating time, but it's just going to be of 20 minutes. Then the food will be taken away. Let's see how fast you can eat. If your child is still not eating, and say if your child has just had half roti and you want to feed 2 rotis, take it away. Be persistent on it and with the patience. What will happen the next third, fourth, fifth time, the child will feel hungry and come. So that's one way of doing it. The second way for slow eaters is by giving them more variety. So before you start, you ask them what they want to eat and give it to them. Okay. Third, you see when is the time during the day when they are most hungry. Every child have their timings when they are most hungry. Some have in the evenings when they'll try and eat a lot of snacks. Some have in the night, some have early morning. So you as a parent, that's the time you grab it to change any kind of food habit. So give them more nutritious food at that time, or just, reduce their eating time. Make eating time fun rather than watching TV. Okay, try these tricks. Try these tips. I'm sure you will see a change. If not, you can always get in touch with me. Okay. Let me see any other question.
Is it okay if I talk right now?
Yes, yes. So, Sarita, is that okay?
Yeah.
I think so. Yes. Who's that?
This is Hira. I just asked you for the.
Yes, Hira. Go on, dear.
But she is 6.5.
Okay.
And her younger brother, he's just 3. He's like, he finishes off his meal in 20 minutes and he's off.
Perfect. So, that's what I was trying to say. Toddlership is the main time when you can change the habit. So she has actually grown about that. So you will have to do it for a longer time because its habit is built in your child. Okay. So she's already, so you have to really, so maybe not 2-3 days, it will go on for a longer time. But if you're persistent, it will happen.
Okay. Because the chips and other things and all, she'll eat off very fast. Only her main meal time, that's her lunch and dinner, she takes around an hour and a half. Like that's, like it's really frustrating at times.
I can understand, but that's why I mentioned in my tip when I was giving, that see the time when she's most hungry. That's the time you feed her nutritious food. Don't give her chips. So evening time, so try and give her meal that time. Okay?
Yeah. Thank you so much.
Welcome, dear. Welcome. Okay. Okay, what's the next question?
You want
Is
me to
there
read out?
any homeopathy treatment for swollen lymph node sports infection? That's from Sangeeta. Hi, Sangeeta. Yes, there are very good medicines on homeopathy that we can help for swollen lymph nodes. One tip I would want to give apart from homeopathy, which you can start, is massage the child. Say if they're having lymph nodes on the neck, okay. Then in the opposite direction, you can take any oil. It could be coconut oil, a little bit of olive oil, and from downward to upward motion, you just massage over the lymph nodes. Just once in a day for 5 minutes, and slowly, you can see the change. Okay. The next is, what about frequent urination? Could it be climatic heat induced? Well, if you're asking me, frequent urination could be climatic. Yes, it could be also seen. I've seen in kids who are nervous, or some children do out of when they don't want to attend a class or something out of fear, and it could be climatic. But if you're asking climatic due to summertime, I would have to think, or maybe the child is having too much water. Okay. And if you still have any doubt, it's okay to do a urine routine and check out if the child has any infection or not. If it comes positive, you can always treat. Okay. Next, this is from Poonam. Guys, drop in your reviews also, how much you liked this session. Was it informative or not, apart from asking questions? So we would like that. Okay. Hira, I think I've answered you. Can you put some light on eating habits? Yes. Somebody asked me, he doesn't chew, stores in mouth for long. Well, that is again a habit developed. Children do not like chewing. And I usually tell parents, even children who are 8 months old, give them a stick of carrot. They will nibble it till they eat. So they don't want to take an effort of chewing. Okay. So try out ways. Maybe the child is bored of eating the same food and therefore wants to store. The child is not interested in food. It just shows that. So try the tips that I gave you. Involve them in food, involve them in making, involve them in deciding food. Make it interesting. Okay. Next is greetings, doctor.
Yatri, read out the whole question so that it comes in the recording as well.
Okay. So somebody is asking, Poonam is asking that what can be reasons for grinding teeth, especially at night, apart from worms? Okay. Poonam, that's again a common problem that I've seen in children. Grinding of teeth could be, yes, of course, due to worms. It could be genetic. It could also be due to some kind of fear, or sometimes they have these dreams that it's in their subconscious mind. Just out of that, they grind their teeth. And in some children, it could be when the tooth are sprouting. So is there internal itching and they're just grinding their teeth. Okay, one of these reasons. If it's too much, again, homeopathy can help. Otherwise, I have seen children outgrow this grinding of teeth by the age of 7 or 8. Usually they outgrow it. So wait and watch. Okay. Sangeeta is saying, thank you so much. It is my pleasure, Sangeeta. Sangeeta also says it's an informative session. Thank you. Ushma says, thank you very much for informative session. Cleared a lot of doubts. Very helpful session indeed. Thank you so much. It was totally my pleasure. Poonam says thanks. And I think we've taken all questions. Sarita, I think
Yes,
I've answered.
I'm here, and thank you so much, Dr. Yatri. It was an amazing session. Though my child is now very 18 years of age, so these topics are not applicable to me. But I'm sure these questions have been coming on the group or on the personal chat to me multiple times. And I used to suggest something or the other, some doctor or some person expert who can help it out. So now today they have Yatri Thacker's contact details, which will be shared on the group after the chat is the whole thing is done. And thank you so much, all the parents. And anybody who has a question later on, they can always put it across on the group, and I will take it forward to Dr. Yatri. If she's not in the group, she's in one of the groups.
Yes.
She's not in all the groups. So she will be addressing those later whenever it's required. So thank you so much everyone for participating, and it was an amazing session, and I will look into it in the recording. Yeah. Thank you.
Thank you. Thanks, Ita.
Thank you.
Pleasure.
Thanks. Bye. Take care.